Good morning. We're here to give an update on COVID-19 in Oregon. I'm joined virtually by Pat Allen, Director of the Oregon Health Authority, Colt Gill, Director of the Oregon Department of Education, and Dr. Dean Seidlinger, our state epidemiologist. First, I want to take a moment to acknowledge what happened this week at our nation's capital and at state houses across the country. Like so many Americans, I'm appalled and saddened. The peaceful transition of power is a bedrock of our democracy, as are free and fair elections and freedom of the press. One of our country's greatest assets has always been our strong democracy. To witness it literally under attack, like we did this week, was both horrifying and heartbreaking. Violence answers nothing, solves nothing, offers nothing. We must never, ever take our democracy for granted. This could not be more clear as we continue to face the ongoing challenges of this pandemic. We entered into this new year with hope following the first COVID-19 vaccinations in Oregon, the passage of a second federal relief bill, and the Oregon legislature's action to deliver a $400 million relief package to Oregonians across the state. And even as this virus continues to threaten us with new contagious strains and feelings of fatigue a year into the pandemic, Oregonians keep showing our strength and our resilience. We have proven time and time again that we are willing to do the hard work to stop the spread of this disease. As a result, we've maintained one of the lowest infection rates and lowest mortality rates in the country. Both Director Allen and Director Gill are here to give updates on two of our biggest priorities right now: ramping up vaccine distribution and doing what we can to get our kids back into the classroom, especially our little ones. On the vaccine front, we're making steady progress toward achieving our goal of 12,000 vaccines administered per day. This is an all hands on deck effort. OHA is working with healthcare providers, pharmacies, and local public health partners to achieve this goal. For example, hospitals like OHSU have stepped up to help vaccinate harder to reach frontline workers, such as our home healthcare workers, behavioral health, and other local providers and first responders. Thank you to all of our hospitals across the state. We continue to look at how we can use every single tool we have to swiftly vaccinate Oregonians. And in that spirit, I've asked General Prendergast to support and coordinate distribution efforts with local public health. We are deploying the National Guard to provide vaccination support, starting this weekend with Salem Health's vaccination event at the State Fairgrounds. Our Guard members will be providing logistical and nursing support. The goal is to vaccinate 250 people per hour, vaccinating thousands of Oregonians. Thank you, Salem Health, for stepping up for your community. I'm certainly encouraged by these efforts. These partnerships and creative thinking are how we do it in Oregon. And it's how we're going to achieve that critical mass of community immunity we need. On the educational front, at the start of the new year, Oregon's COVID-19 health metrics for returning to in-person instruction became advisory, empowering local school districts and communities to make decisions regarding in-person instruction that best meet the needs of their families and their students. As this disease threatens to rob almost a full school year of classroom instruction from many of our children, it's absolutely vital to help our kids safely return to in-person instruction as soon as possible. And while I've prioritized educators from early learning to high school to be next in line to receive the vaccine, we've seen across the world how schools can reopen with rigorous health protocols in place. All Oregon schools will still be required to adhere to health and safety measures in order to open any in-person instruction, and they must continue to work in close consultation with their local public health authority. Director Colt-Gill will share more. I want to end this morning by saying that we're still waiting to see the impact of our actions over the holidays and New Year's, and whether a second and possibly worse winter surge is headed our way. So as we brace for what may come, I want to again thank all of you who continue to sacrifice every single day as we continue to fight this pandemic. Thank you for keeping up the great work to minimize COVID spread. Each day that passes, we're vaccinating more Oregonians and taking more steps toward building a safer and stronger Oregon. Please keep it up and stay safe out there. And with that, I'm going to turn it over to Director Allen.
Thank you, Governor Brown. Again, I'm Patrick Allen, Director of the Oregon Health Authority. I want to give you an update on the actions we announced earlier this week to speed vaccination in Oregon and share what our latest forecast tells us about the severity of COVID-19 in the state. First, let's look at our latest COVID-19 vaccination numbers. As of January 6th, Oregon has received a cumulative total of 128,700 doses of Pfizer vaccine and 121,400 doses of Moderna vaccine for a total of 250,100 doses. As of yesterday, Oregon has vaccinated a total of 73,286 healthcare workers, first responders, and others, as well as staff and residents at skilled nursing facilities and memory care centers where our most vulnerable seniors live. According to the latest CDC data, Oregon remains in the middle of the pack among states in the rollout. Oregon ranks 36th in the nation at 1.5% of our residents who are vaccinated. We're ahead of California, which is at 1.3%, and just behind Washington, which has vaccinated 1.6% of their residents. 25 states are grouped together between 1.3% and 1.8%. We rank 37th in the nation at 24% of the amount of vaccine doses administered so far. We're ahead there of both Washington and California. As I said on Tuesday, though, it's not good enough to be in the middle of the pack. We need to get vaccines to every Oregonian because vaccination is the safest, most effective, and most reliable way to prevent yourself and the people around you from becoming infected with COVID-19. According to a recent study, more than half of COVID-19 survivors reported moderate to severe symptoms. No one wants to get this disease. And because Oregon has done a better job at containing COVID-19, we're also more vulnerable to an overwhelming spike in hospitalizations and deaths if the virus takes hold and cases spin out of control. That's why we want to vaccinate every person we can as soon as possible, given the limited supply of vaccines we receive from the federal government. Now, I want to update you on the steps we announced earlier this week to accelerate the distribution of vaccine in Oregon. Our goal is to achieve the governor's target of 12,000 doses being delivered per day by the end of next week. On Tuesday, I described 5 actions OHA was taking to reach that goal. The first action was to simplify and speed up the Phase 1A process. We want to get healthcare workers, first responders, people living in congregate settings, and others in that priority group vaccinated so we can move to education workers, critical workers, vulnerable populations, and the general public as fast as our supplies allow. Getting more vaccines in the hands of providers who are ready and able to vaccinate large numbers of people is a vital part of our strategy. OHA has delivered vaccine doses to 190 sites across the state already. We'll allocate vaccine doses to an additional 30 sites next week, including hospitals, local public health agencies, federally qualified health centers and rural health clinics, urgent care clinics, retail pharmacies, and emergency response agencies. I want to be clear. OHA allocates vaccines to sites, but they are shipped directly to these vaccine administration locations through vaccine manufacturers or the federal government. These vaccines don't pass through OHA's hands, but are routed immediately to the hands of vaccine administrators and the arms of people in Oregon. We know that many of these partners are working hard to enter their data on doses they've administered, but many have experienced significant data underreporting issues. Others appear to have significant numbers of vaccines on hand. That's affecting Oregon's statewide total to date. Here's how we're going to work to solve that problem. Yesterday, OHA staff called more than 100 sites to review their vaccination plans. We wanted to identify sites that are able to maximize throughput and assess their ability to distribute more doses if we allocated additional vaccines to these locations. Based on that information, OHA has adjusted the way we allocate doses to vaccine administration sites around the state next week. Sites with plans to administer the doses they receive within 7 days are being prioritized. We will also prioritize sites with the commitment and capacity to deliver high volumes of doses to healthcare workers, first responders, long-term care residents, and other members of the Phase 1A group. As the governor indicated, one of those sites is Salem Health. Salem Health is conducting a mass COVID-19 vaccination clinic for members of Phase 1A who live in Marion County, which has been hard hit with high COVID infection rates since the start of the pandemic. Members of the Oregon National Guard are helping to administer those vaccine doses. To support the effort, OHA is distributing 10,000 doses of Pfizer vaccine to Salem Health next week. Another step we announced on Tuesday was our intent to activate contracts with Part B of the Federal Pharmacy Partnership to dramatically expand and accelerate vaccinations in long-term care programs. This week, we formally activated Part B. As a result, federal pharmacy partners will begin receiving doses next week to vaccinate residents and staff in the expanded number of settings, including assisted living facilities, adult foster homes, residential treatment facilities, independent living facilities, and a variety of other congregate care settings. The first allocation of 19,500 doses to supply vaccine to this program will be made next week and shipped by CDC to pharmacies the following week at Oregon's direction. Consanus, Walgreens, and CVS are working hard to prepare plans to vaccinate the 75,000 staff and residents enrolled in this Part B program as quickly as possible. In addition, we said we would enlist retail pharmacies earlier than previously outlined in Oregon's vaccine distribution plan to make it simpler and easier for people in Phase 1A to get vaccinated. Since Tuesday, Oregon took steps to activate retail pharmacies and gathered information about pharmacy sites enrolled with the CDC who are ready and able to process COVID-19 vaccines. Pharmacies participating in this program are located throughout the state and will provide much needed access points for independent healthcare providers and other groups without a clear point to access vaccine. We've identified pharmacy partners in all Oregon counties who will enable us to serve more of the 300 to 400,000 people in Phase 1A sooner, as well as in following phases of distribution. We expect doses to flow to pharmacies across the state beginning next week. We'll detail additional steps under our other priority actions, including other locations where we're prioritizing and reallocating doses next week. Finally, let me share a brief summary of our latest COVID-19 forecast. Dr. Dean Seidlinger is here to answer questions you may have about this latest model. We estimate the statewide transmission rate fell dramatically in late November to 0.8 and stayed near that level through mid-December. Oregonians stayed home at Thanksgiving and it made a difference. Thank you. Unfortunately, we've seen a sharp increase as we approach the rest of the winter holidays. As of December 23rd, the statewide transmission rate was likely between 1.14 and 1.45, with a best estimate of 1.29. And this estimate does not reflect any potential further increase in transmission related to social gatherings over Christmas and New Year's Eve. This means we could continue to see a sharp increase in diagnosed cases, with daily reported cases reaching 1,780 cases by January 26th, if the rate didn't increase due to holiday gatherings. Under this scenario, new hospitalizations would increase to 85 per day by January 26th. If it turns out that people are more cautious starting January 9th and COVID-19 transmission rates drop back to the early December level of 0.9, our outlook appears a little less grim. New diagnosed cases would be 470 per 100,000 people for the 2-week period between January 13th and January 26th. It's an average of 1,400 new cases per day. There would be about 55 new hospitalizations per day by January 26th. The good news is our model is a little more pessimistic than other national models. And in Oregon, mask use remains at an all-time high. Vehicle traffic remains down, as does air travel apart from spikes around the holidays. Most Oregonians continue to see COVID-19 for the serious threat it represents, and their actions reflect their concern. But the virus is spreading faster again across the nation. The holidays brought many people together, and the coming weeks could pose our greatest challenge yet. I know it's hard to hear about cases going up again, especially after more than 10 months of fighting COVID-19. Every day we look for a ray of hope. There is hope. The vaccines are here and more people are getting immunized every day. We know what to do to stay safe. So we lift ourselves up, we remember all that's at stake and the people around us who are at risk, and we do it again because we're strong and we can count on each other. Until a mass of Oregonians get vaccinated and we end this pandemic, I want to encourage all of us to stay strong. Let's count on each other. Wear your mask. Limit indoor social gatherings. Avoid large groups. Stay home when you're sick and wash your hands often and wash them well. Thank you.
Thanks, Director Allen. I'm now going to turn it over to Colt Gill. He's Director of the Department of Education. Thanks, Colt.
Morning. Thank you, Governor Brown. I'm going to circle back around to some direction that the governor offered to us in December. Now, on December 23rd, Governor Brown shared in a letter to Director Allen and myself, she asked that we take stock of our state's response to COVID-19 in our schools. We've done this through internal reviews of our guidance and through outreach and engagement with many partners. This week alone, we've engaged with multiple school and community partners to hear their input about the challenges that they face and how we can help address those challenges in our schools and seek the best approach to serving students in their communities. School districts across Oregon are also holding similar meetings at the local level to better understand what is working well and what challenges students, families, and educators are facing. Earlier in December, I also held listening sessions with teachers from across the state. We had well over 800 participants in these teacher meetings. They were representative of Oregon's teachers, both racially and ethnically, geographically, and by their teaching assignments. Our teachers shared that while they see some students thriving in our virtual environments, they're also seeing more family engagement than ever before, and they see themselves gaining more skills while teaching online. However, they also raise serious concerns about growing inequities and disparities for our students of color and those navigating poverty and houselessness. We published these key themes and takeaways from these meetings in a 40-page report in December. Also in her letter, Governor Brown provided further direction to the state's response to COVID-19 in our schools. She called for 5 actions. The first was to stay grounded in the evidence and science and to work together to transition to in-person instruction, especially for our youngest learners in elementary school. Second, she called for schools to partner with the Oregon Health Authority to provide for on-site COVID-19 testing at schools for symptomatic individuals and for those that have been in close contact with a positive case of COVID-19. Third, to transition those health metrics for returning to in-person instruction from mandatory to advisory on January 1st, and to review those same metrics for any possible updates by January 19th. And finally, number 5, to align schools guidance and employer rules to ensure that all necessary health and safety protocols are included to allow maximum access to in-person instruction and less confusion. Activity is progressing in each of these areas. Decision-making for returning to in-person instruction has now shifted to the local level through that transition to advisory metrics on January 1st. Now, to stay grounded in the science and evidence, we know that 2 factors remain important for determining when students will return to in-person instruction for our local leaders. The first is to ensure that community case counts are at a low enough number that the community is not regularly introducing COVID-19 into the school. That destabilizes the learning environment as contact tracing leads to quarantining of individuals. This is still an area where Oregon and most of the nation is challenged. We need to reduce our community rates of COVID-19. To maintain a stable learning environment, it is critical for local school districts to continue to closely monitor the data at their county level, as well as work with their local public health authority to consider any kind of more localized data to understand the level of COVID-19 in their community. The second factor is their ability to implement our public health and safety protocols and requirements for the schools. This includes diligent entry screening protocols, universal use of face coverings, physical distancing, cohorting, frequent hand washing, and many, many other requirements in our Ready Schools Safe Learners guidance. Oregon has comprehensive and thoughtful guidance that outlines 164 different health and safety protocols that must be in place to serve students in person. These requirements remain mandatory. These protocols are mitigating the risk of transmission in schools in Oregon and across the country and really around the world when they're implemented with fidelity. As the governor requested, we're also collaborating with the Oregon Health Authority and Oregon OSHA to review various portions of those requirements and recommendations in our schools guidance. Any updates based on those reviews and the engagement sessions that we've been holding will be published on or around January 19th and help to update our schools. Leaders from the Oregon Health Authority can speak with more detail to the plan for COVID-19 testing in schools. However, we are working closely to support this effort to provide on-site testing in our schools. This will be an incredibly valuable resource moving forward. Additionally, the state will be receiving approximately $500 million from the Federal Consolidated Appropriation Act's Elementary and Secondary School Emergency Relief Fund. These funds can be used to support COVID-19 efforts in our schools, giving them the resources that they need to provide academic and mental health supports, as well as to meet logistical and physical plant requirements in our guidance. We will learn more about these resources in the coming days, and we will work closely with the legislature and others to move these funds to Oregon schools as quickly as possible. While we need to remain vigilant and aware of the pandemic's progress in Oregon, there is great hope on the horizon. With comprehensive protocols well in place, and with a pathway to on-site testing, as well as vaccines for our school staff, and additional federal resources on the way, our schools will soon have the tools they need to return to in-person instruction. Thank you, Governor.
Thank you, Director Gill. And with that, Charles, I believe we're ready for questions.
Thank you, Governor. Just a quick reminder to all our reporters, please use the raise your hand function to get into the queue to ask a question. We'll start with Lachey Wesley from K2. Go ahead, Lachey.
Hi, good morning. Thanks for taking my question. I have two questions about both schools and also about the vaccines. For example, Washington released a timeline including when seniors and grocery store workers can get the vaccine yesterday. Why did Oregon wait to form the advisory committee? It met for the first time yesterday. And then about schools, how do districts plan when they didn't have a defined plan from the state?
Thank you, Lachey. I'm going to turn the vaccination question over to Director Allen and the schools question over to Director Gill. But what I would say is this. We're working as hard as we can. We are using every single tool in the toolbox, and it's certainly an all hands on deck moment for Oregon to get as many vaccinations completed as quickly as possible. We are focused right now on our 1A population, which includes healthcare workers and vulnerable seniors and others living in congregate care and first responders. And then, as you know, I prioritized in 1B our educators, our child care providers, our early childhood educators, and our school personnel, because we want to get our children back into the classroom as safely and as quickly as possible. With that, I'm going to turn it over to Director Allen.
Thanks, Governor. I guess I would say two things to that. First, we have prioritized nearly 500,000 Oregonians ahead of the prioritization work that the advisory committee is doing. Second, the information that we've had about which vaccines are available, what the indications are for them, age ranges, those kinds of things have been in extreme flux up until this very moment, but certainly until very recently. And so we thought it was better, given the amount of prioritization we've already done in Oregon, to convene that group after we knew as much information about these vaccines as we could, and that's why we followed the timeline we're following. We're also working very hard with the advisory committee to accelerate the decision-making process as quickly as we can. And our target is to get sequencing decisions done by the end of this month.
Thanks. Should I jump in, Governor?
Go ahead, go ahead. I didn't hear all of Lachey's question on schools, but I'm hoping you picked it up.
I think so. So what I wanted to share is that Oregon actually put out guidance, was one of the earliest states to put out both guidance and metrics for returning to in-person instruction. We did that back in July. It's considered some of the most comprehensive guidance for operating schools, both in person and through comprehensive distance learning in the country. Widely regarded in that way by other education facilities around the country and medical partners as well. There are really clear guidelines. Our guidance, just the single document alone, the lead document is about 89 pages long, and there are several supplementary documents. It includes 3 sections, 164 different requirements, and nearly that many different recommendations for special circumstances for operating in person. So the schools really do have a pathway, a blueprint for operating in person. And in fact, we have schools that have been operating in person in Oregon since September and doing that following these protocols. Each of those schools is required to develop their own operational blueprint based on our requirements to let their staff, their students, and their community members know exactly how they are aligning to each of the requirements that the state puts forward. Those are published on their school websites, and they're also published on the Oregon Department of Education website.
Just one follow-up. We've known that the vaccine was in development for several months. Why wasn't Oregon forming that advisory panel, making those plans about sequencing earlier?
Director Allen, do you want to take that one?
Yeah, I guess I would just repeat the answer I gave a minute ago, which is we've already prioritized 500,000 Oregonians that we're working our way through now in phase 1A, and then moving on to education and early learning employees. Information about the vaccines at a detailed level has been in serious flux throughout this process. And so we elected to do the advisory committee a little bit later so it could do its work based on better information.
Thanks, Lachey. We'll go next to Lisa Balick with COIN. Go ahead, Lisa.
Yes, good morning. Governor, you've said all along that you're basing decisions on science and data. That's why the CDC recommends that people over 75 and those with major health conditions go before teachers. Why have you decided not to follow this guidance? And essentially, what do you say to the seniors who now are being pushed back in the line?
Look, these are really, really tough decisions. And the harsh reality is that we do not have enough vaccines to vaccinate everyone at once, which would be how I wish we could be operating. In terms of educators, childcare personnel, and our early childhood educators, the harsh reality is that many of our kids across the state have been out of school for almost a year now in terms of in-classroom learning. It's extremely challenging for a lot of kids, particularly our littles, to be learning how to read or learning how to do math on a computer remotely. We have communities across the state that are not well connected or not connected to the internet. We have families who, frankly, have struggled to get the resources, whether computers or internet access, so that their children could go on to learn through comprehensive distance learning. It's been a huge challenge for these kids, and I'm gravely concerned about the impacts on our children, particularly our children of color, our low-income children, and our children living in rural communities. I'm concerned that these gaps are going to be very hard to overcome. And I think for Oregon's future, we should be all focused on how we can get our kids back into the classroom safely as quickly as possible.
So what do you say to seniors?
Look, this is really, really challenging. We have seniors in congregate care facilities, particularly in skilled nursing care and in memory units that are getting vaccinated as we speak. As Director Allen spoke, we're working hard to make sure that all of those seniors living in congregate care facilities are getting vaccinated. In terms of seniors that are living independently, I encourage them to continue to take precautions. Wear your mask, maintain physical distancing, wash your hands, watch your social gatherings. We're working hard and as quickly as we can to get vaccines out to all of our vulnerable populations, including our elderly.
Thanks, Lisa. We have about 15 people in the queue. We're not going to be able to get to everyone today, but if people can ask just one follow-up or ask your questions so we can try and get to as many people as possible. We'll go next to Mira Powell with OPB. Thanks, Mira.
Hey, Governor. I was wondering if you could briefly summarize the decision of prioritizing early education and high school educators for the vaccine, but omitting post-secondary educators from that group. And is there any word on when those educators would be included in the vaccination process?
Thank you. In terms of educators and staff at our institutions of higher education, our community colleges and our universities, those groups are in 1B and will be prioritized by the Vaccine Advisory Committee. In terms of my rationale for vaccinating child care providers, early childhood educators, and K through 12, as I just mentioned earlier, I'm absolutely committed. I know that the impacts of for our children having to learn online have been very, very challenging, not just from an educational standpoint, but from a social and emotional standpoint, also from a social interaction standpoint. So it's been really challenging for our children, and I think this needs to be a priority. In terms of childcare and early childhood educators, we know that the vast majority of brain development happens in the first 5 years. So it's critically important that we get these educational tools and resources to our children who need it the most. And then in terms of childcare, I know that many, many parents across the state have been struggling with trying to be a childcare provider, trying to be a teacher, and trying to do their work. And so we think it's really important that we take care of these folks so that folks have access, safe access, continued safe access to childcare, early childhood education, and K through 12.
Thanks, Mira. We'll go next to Pat Durst with KGW. Go ahead, Pat.
Thank you. Two-part question. One is for Director Allen. Why announce earlier this week that you were opening the tiers in 1A without a plan in place for where people could go to get their vaccinations or any information on even if they could find out if there was a place? And also, why was there no plan in place? And then for the governor, do you find the OHA is meeting your expectations? Do you think they'll hit 12,000 a day vaccinations by the end of next week? And will anyone be held accountable if that does not happen? Thank you.
Thank you, Pat. And I'll take the second part of the question first. That is, Oregon is the little engine that could. We were one of the states with the first incidences of COVID-19 in the nation that was not connected to travel. We have had hot spots to the north of us. We have had hot spots in Idaho, and certainly we've had hot spots in California. Despite that, Oregonians have made the tremendous sacrifices and made really difficult decisions to slow the transmission of the disease and slow the spread of the disease. And as a result, as you know, Pat, we have one of the lowest infection rates in the country and one of the lowest mortality rates per capita in the country. I am confident, given what's happened this week and in prior weeks, that the Oregon Health Authority, in partnership with many, many partners, including our incredible friends at local public health, our hospitals, our healthcare providers, the volunteer members of the Oregon National Guard, that with this combined effort, that we will be able to meet those goals quickly.
I'll go ahead and take the first part of the question. And I would say that we had a plan, which was to move through the various groupings of 1A one by one. And part of what we wanted to do was we learn about COVID throughout this pandemic. We learn about issues about testing. We learn about issues around transmission, what does or doesn't transmit. We learn about how to protect ourselves, what does and doesn't work. We've learned about what treatments do and don't work. And at every stage, you know, the phrase got used a lot at the very beginning of a novel coronavirus, a new virus. And that's really played out throughout the pandemic, where there is new information coming out all the time. When we rolled out the vaccines through hospitals, we learned a lot about vaccine administration. We learned about some of the complexities of it. And we learned about how that step-by-step four-group prioritization was going to, in fact, slow down distribution. So what we wanted to do on Tuesday was announce as quickly as we possibly could that we were going to learn from that experience and make a change, and not wait to tell people that until we had completed the detailed plans that we needed to based on what we learned through hospital distribution. This is a complicated vaccine to distribute. It's more complicated than we expected when we made our initial plans, and we're adapting and shifting our plans as we go and as we learn more.
Thanks, Pat. We'll go next to Gary Warner with EO Media. Go ahead, Gary.
Okay, there we go. Pat probably knows where this is going. It's the question I ask just about every time. Nobody doubts that the health authorities in the state are working really hard and have the best interests of the state at heart. But what I hear out with my neighbors and the readers is, when is it going to be my turn to get the shot? And they're all thinking, oh, it's going to be a month or 2 months or 3 months. And in our last discussion, when Director Allen and I were all trying to do some math there, we're really talking about not until the end of the year or maybe next year. Why isn't it a role to basically, some people feel like they're not getting the straight scoop. Why not come out and tell people, here's the reality of the timeline right now, and we'd love to shorten it, but you know, if you're in this group, you know, we're not talking about summer, we're talking about fall, we're talking about maybe Christmas. That's the question.
Director Allen, do you want to pick that one up?
I do, and Gary, I feel like every time I've answered that question for you, we've tried to put out that message as we've talked about this over and over again. We have said it's going to take months to get to all Oregonians, and if I need to say that again today very clearly, it is going to take many months before we have vaccinated enough Oregonians to reach a degree of herd immunity. I want to be really clear about that. As I just indicated, we have 500,000 people in Group 1A before we even move on to, or that we need to get substantially through to move on to the next prioritized groups. This is going to take a while. I think it's been challenging for people to hear that messaging from us when the federal government has been much more optimistic in its messaging and talking about, how many doses how many people would be vaccinated by the end of the year, that virtually everybody who wants a vaccine would be able to get it by June. That's just not what the numbers indicate unless many more vaccines are approved or much more production it comes online, or more doses are purchased from manufacturers that are available now. So again, I'll be really clear. This is going to take a long time to get to herd immunity. We're going to go as fast as we can. We're going to continue to ramp up production, but it's going to take a while.
But when you say several months, you're talking about double figures on that for some people. You know, several months,
absolutely.
3 or 4.
I think fall is a reasonable target based on what I think we understand about production and what I think we understand about potential other vaccines in the pipeline. But again, like I talked about earlier, we keep learning new things seemingly every day about everything about this virus. And so, that projection could happen sooner. It could happen later. It could be that these new variants of the virus that we've been reading about introduce more complexity to the vaccination program. There just continue to be all sorts of variables, some of which we can account for, and some of which we don't even know that they're there yet.
Thank you for the clarity on that, Director Allen. I appreciate it.
Mm-hmm.
Thanks, Gary. We'll go next to John Hendricks with KPDB. Go ahead, John.
My question is, are there any plans like what Salem Health in Marion County is doing to set up these vaccine clinics to do them across the state? They seem to be pretty successful with 1,700 doses given just yesterday. And would you send in the National Guard to help at those other sites as well?
Absolutely. I'm really proud of the work that our volunteer National Guardsmen and women have done over the last year, frankly, over the last several years, but in the last year in particular, helping out during the pandemic, supply distribution to communities around the state, helping us respond to historic wildfires in the fall. And it's because of those incredible efforts that I called General Pendergrass this week to ask him to take some time off from his work at Nike to help us make sure that we are coordinating with local public health. And I really appreciate our National Guardsmen and men and women willingness to volunteer and assist us with vaccine support efforts, whether it's local efforts right here in Salem with Salem Health, but I expect that they will be assisting with other efforts and other community efforts across the state.
Thanks, John. We'll go next to Amy Green with the Oregonian. Go ahead, Amy.
Yes, hi, thank you. There has been a lot of frustration out there among healthcare workers who work for hospitals and health systems, so places that have had the vaccine delivered. Healthcare workers at one institution are frustrated that healthcare workers at another institution have gotten the vaccine already, whereas they haven't. For example, people who work at home in IT departments or in accounting or marketing. In some institutions like OHSU, they have or can get the vaccine, whereas in Kaiser, they haven't. Is there anything wrong or against protocol if that has been happening, if OHSU had already opened up vaccinations to everyone even before OHA had announced it?
Director Allen, do you want to respond to that question, please?
Yeah, thanks. The definition of healthcare worker in Phase 1A is quite broad. And it includes people not only, who would show up in someone's hospital room, but people who can be exposed to virus directly and indirectly. And so that casts a pretty wide net. That said, there is a nexus around being a healthcare worker with a risk of exposure. And we've indicated out to health systems that they do need to follow in Phase 1A the definition of healthcare worker. Earlier in the week or late last week, if some systems had jumped the gun a little bit to other healthcare workers, I'm not sure that's a terrible thing. I think there's also an extreme pressure to want to get through Category 1A and move on to Category 1B. So yeah, I am concerned about people with no nexus receiving vaccine, but I also want to get vaccine in people's shoulders.
So is the definition of a healthcare worker anyone essentially who works for a hospital or a health system? That's my reading of it.
No, I don't think it's quite as broad as that. I think if you look at the documentation we have online, it starts with risk with direct or indirect risk of exposure to the virus or materials that could transmit the virus.
So could that be people in accounting who are working at home? Or people in IT who are working at home because they might go into the office once in a while or come into they could interact with nurses whose computer breaks down?
Well, so you just talked about two really different circumstances that illustrate why this is hard to just kind of make blanket pronouncements. If someone's working at home and they're never coming in, or there's a thought that they might come in, I think that's a stretch. If you've got people who primarily work at home, but do regularly go in to do tech support work or those kinds of things, I think that's that risk of indirect exposure. So, I think these circumstances are going to vary almost from person to person within health systems. It's a broad definition, but the nexus really is exposure.
Thank you.
Thanks, Amy. We'll go next to Andrew Selsky with the AP. Go ahead, Andrew.
Hi there. Hello, Governor. Thanks for taking my question. There's a movement among some restaurants to reopen in violation of your orders against indoor dining. You issued a statement on it on Sunday, I believe, but what if this really takes off and hundreds of restaurants do it? How could Oregon OSHA keep up? At what point does it become unmanageable? And what are your plans for tamping down on this eventuality?
Well, Andrew, thank you. And I really appreciate the question. I know it's extremely frustrating for restaurant owners, bar owners, recreational facility owners across the state. That's why I was so pleased that the Oregon legislature made a move to set aside some dollars to help these struggling businesses. As well, the Congress finally took action after our calls for months and months and months to invest additional resources into programs like the PPP, the Paycheck Protection Program, which I hope will go to these businesses that have truly been hard hit by the pandemic and by our efforts to slow the spread of the disease and reduce the transmission of the disease. In terms of Oregon OSHA, I know Michael and his team have been working very, very hard to work with these owners, business owners across the state. They've had very aggressive efforts. And the good news is the vast majority of Oregon businesses are complying with the safety protocol. And I'm really grateful for the sacrifices that these business owners have made and are taking to protect the health and safety of Oregonians. Obviously, our hope is that we can get the community spread down quickly. I did mention that we have not yet seen the impacts of the holidays, particularly New Year's Eve. So we are very concerned. I am very concerned about an additional surge and our hospital bed capacity. But I'm hoping that the majority of Oregonians and our businesses will abide by these safety protocol and do what's right to keep themselves safe, their family members safe, and their community members safe. Dr. Seidlinger, do you want to add anything to that?
Sure. Thank you, Governor Brown. The decisions on impacts on restaurants, on limitations of gathering sizes, when we make those recommendations, they're not taken lightly. We're trying to prevent the spread of this disease, which has caused, many people to be hospitalized, untold number of deaths here in Oregon, and has really disproportionately impacted many communities. But we know that limiting contact, particularly in settings where the virus can spread easily, such as restaurants, where people can't wear their masks indoors, where they sit with people from outside their household, can facilitate transmission. And we have seen some outbreaks here in Oregon, and we've seen much more evidence of that across the country. So I think it's important that we follow these guidance, that we try and keep our spread down where it is, so that people have access to the hospital care that they deserve, so that we can get through these next couple of months as vaccination picks up and keep Oregon as successful as it is in fighting these restaurants. And I encourage those who can support those local businesses. Order takeout, go get pickup, support businesses in the way you can, so that as we come back out of this, they're still there to serve us. But we're all in this together, and I know these sacrifices have been incredible, particularly for our small businesses.
Thank you. I just had a quick question about the event this weekend at the Oregon State Fairgrounds. Obviously, lots of people are going to show up. A lot of doses are going to be provided there. How do the people that are administering it sort through the eligibility of those that are going to show up to actually receive it, that they're in the proper category?
Thanks, Andrew. I'm going to turn that question over to Director Allen.
Yeah, thanks, Governor. Basically, people will be asked to provide, as a part of the information they're providing, a self-attestation that they qualify in the phase 1A category. This is part of the process of simplifying 1A and being able to get through that category as quickly as we can so we can move on to 1B.
Thank you.
Thanks, Andrew. We have time for just a few more questions. So we're going to go next to Natalie Pate with the Statesman Journal. Go ahead, Natalie.
Hi, thank you. My question, this is probably for Colt, but in general, I'm trying to get an idea of how many districts might be reopening sooner than anticipated because of the change in making the metrics advisory, and also what's a realistic timeline for once they actually have shown that they are following the protocol that students will be returning in person.
Natalie, I only have anecdotal information from that I've heard on the news, OPB, or read in the newspaper. So I'm going to turn that over to Director Gill.
Thank you, Governor. Natalie, and that's just correct. So right now, school districts are in the midst of having community conversations with their own staff and with their school boards, and are making those decisions. So we do know a number of districts that have come out and begun to name plans for when they would begin to stage reopening to in-person instruction. Most of them are following our guidance to wait until after January 19th when we update that guidance so that they understand what the latest requirements and protocols will be. Most of them are also following our guidance, as we've seen, that they are starting small. So most of them are trying to bring in their youngest learners first, make sure that they can manage those cohorts appropriately and get everybody sort of regulated and trained in the new way that we go to school. So you see a lot of them starting with kindergarten and first grade, and then having plans to build up from there in the future. Those are the articles that I've seen. Now, as the schools actually do open, we do have a required reporting process. So each week, each Friday, each of our schools reports to the Oregon Department of Education to let us know how they're operating, under which instructional model, and how many students are on site. This helps us to provide additional information for data gathering to the Oregon Health Authority, and helps us understand how each district is operating. But they are also required to turn in their blueprint for in-person instruction prior to opening to in-person instruction. So we'll be able to watch that portal as well and see those plans begin to come in over this month and probably into February would be my guess as well.
Quick follow-up on that, for the numbers that are being tracked on Fridays, is that true of schools that have already opened in some capacity, and does that track if they've had cases that have tested positive or had any student or teacher deaths? Yes, so there are actually two places to look. So we have posted on our website a weekly status update that will let you know about every school in Oregon and how it's operating, both private and public schools. So you can check that website. Currently, we have close to, I think right now it's a little bit over 50,000 students that are attending in-person instruction. That it's been fluctuating between about 30,000 and 60,000 throughout the fall and now into the winter. The Oregon Health Authority, as part of their weekly report, is where you can find information about cases that have shown up in schools. And again, we've seen very little transmission in schools from one person to another. So typically what you see there is a case, not a time when somebody has contracted the illness from another person at the school site.
Thanks, Natalie. We have time for just one more question, so I'm going to go to Erin Ross with OPB. Go ahead, Erin.
Hi, Charles. Thank you. My question is about the decision to roll out with teachers instead of with over 75s. So one of the reasons for ACIP's guidance on vaccinating people over the age of 75 first in 1B, beyond obviously the horrifying 80% mortality rate for that demographic, is that as we reopen the economy, the exposure of that demographic will increase, particularly in multi-generational homes. And as we know, multi-generational living has proved to be a major risk factor for contracting COVID-19 and is also an equity factor, which is why ACIP recommends also vaccinating those who live with people over the age of 75 in that first wave to limit their exposure. So my question for you is, if OHA proceeds to vaccinate teachers ahead of seniors and schools begin to reopen, how will you protect those seniors who live in multi-generational homes with school-age children from their significantly increased exposure risk?
Director Allen, Dr. Seidlinger, would either one of you like to respond to that question?
Sure, Governor Brown, I can take that. This is Dean Seidlinger. The decisions on prioritizing vaccine, as the governor said, have been very difficult and weighing risks and benefits. I will say there is that equity issue you mentioned with seniors, but that equity issue exists when we look at vaccinating educators and school staff to return them to in-person instruction with lower risk. There are many children who are not being served by comprehensive distance learning right now. As Director Gill said, some connections with families are stronger and some children have thrived, but we know that's not equal across our communities, and children living in poverty and their families have been disproportionately impacted. So we know that families have struggled for 10 months in managing multi-generational households. I, for one, live with an older adult and have another person in the house who works in healthcare. And so every day, we worry about transmitting that virus within our home to a person who's 81 and who be severely impacted. We've made changes in how we interact. We take extra precautions, and that's what many of our multi-generational families have done, who have employees who've continued to be essential workers, who've had kids who've continued to attend childcare. So we're asking families to continue those activities, to continue to make those changes and some sacrifices that they've made for just a little bit longer as we continue to roll out vaccine as quick as it comes here into Oregon.
So just to be clear, are you saying that the amount of time that it would take to vaccinate all of the over 75s would be, after a year of no school, an amount of time that would be detrimental to children's education? And you are not saying that the amount of time that it would take to vaccinate all of those teachers you're assuming that will not be leading to increased deaths among people over the age of 75. That's a big chunk of time that they are going to be unprotected. How are you weighing the risk of that versus a slight delay in when children get back to school?
I think what we're looking at is that we have a defined population that works in childcare, that works in K-12 schools, that are providing a vital service, not to the children in their care, but to the families that have been, as Governor Brown said, struggling to manage work, being a parent, being a teacher all at the same time. And as we vaccinate these people, we will work with our Vaccine Advisory Committee to see what are the following priorities for phase 1B. We know that some people will have to wait, as we don't have enough vaccine to provide vaccination to every Oregonian who wants it all at the same time. And so there are detrimental impacts on both sides, delaying vaccine and delaying return of children to school, delaying vaccine to elderly individuals, or delaying vaccine to other members in the phase 1B. All of these populations are prioritized because they have reasons for complications from COVID-19, disproportionately impacted by COVID-19, or disproportionately exposed to COVID-19. And so making some of those decisions based on federal recommendations, based on conditions here in Oregon, trying to make the best decisions to serve Oregonians and to always do it with an equity lens, so that we can make sure that those who've been most disproportionately impacted have access to vaccine.
Thank you.
Thank you, Aaron. That's all the time we have for questions, so I'll turn it back to Governor Brown.
Thank you very much, Charles. Thank you all. Please stay safe out there, and we'll look forward to seeing you soon.